Hello, everybody. Thank you so much for joining us today. Sorry about the slight delay. We're having some technical difficulties. But yeah, thank you guys so much for coming today. And today we are going to be discussing some common FAQs for periods. So yeah, welcome to Birth Control Trends Tuesday. My name is Ananya, and again, I'm here with our CEO and co-founder, Dr. Yen. She's the CEO and co-founder of Pandia Health. Every Tuesday, Dr. Yen and I are going to address some popular birth control questions. Before we get started, make sure that if you already have an active prescription for birth control, sign up for free delivery right here and automatic refills of your birth control straight to your mailbox. If you need a new prescription and you're in California, Florida, Louisiana, or Texas, then you can sign up for an online doctor's consult with one of our expert doctors, again, right here. And you can use referral code TRENDING so you know how you heard about us. Now, let's get into the topic for today. Like I said, we're going to be discussing some common FAQs that Google has kind of compiled for us, some common period FAQs. Okay, so is everybody able to see Dr. Yen? Why don't you leave a comment and see if you can't see Dr. Yen right now? You should be able to.
There we go. 3, 2, 1.
Oh, awesome. Okay. Sorry, I thought I clicked that before. My bad. But again,
can you
yes.
hear me?
Yes, I can hear you now.
Yay!
Awesome. Sorry about that, guys, again. But yeah, so thank you so much for being here, Dr. Yen. Today we're going to start off with, like I said, some FAQs about birth control. Number 1, does melatonin cancel out birth control? Can you talk a little bit about what melatonin is for people who don't know and also how it affects birth control?
Yeah, so we just wrote an amazing detailed blog on melatonin, and melatonin is released by your body in response to light, and it sets your clock. So first of all, I want to make sure everybody's taking melatonin properly. The proper way to take melatonin is not, it's 3 a.m., I'm tumbling around, I can't fall asleep, I'm going to take my melatonin now. Because then you've set your clock to go to bed every day at 30 minutes after the time you took it. So if you took it at 3 a.m., then you've now set your clock to go to bed every day at 3:30. That is not what you want to do. What you want to do is like, I'm going to a foreign country or I'm going across country and I need to go to bed by 10:30. So then you take it at 10 p.m. on your way there. Then you take it again when you get there at 10 p.m. and that should set your clock for the rest of the week. And for me, it totally works because I am like a night owl, but I was like following the instructions. And so I took it exactly at 10 p.m. I usually go to bed at midnight or 3 a.m. But after I took 2 doses every day for the next week, exactly at 10:30, I'd be like, oh, so sleepy, fall asleep. So 1, make sure you're taking it the right way. It's not a sleeping pill. It's to set your clock to go to sleep at the right time. And then, as I mentioned, 2 doses should be enough to last you for the week. You shouldn't need it every single day. Certainly, they use it for babies in the ICU every single day, but I also think they're not testing them, right? They should really do 2 days and then see if they needed it the rest of the week. You know, just minimize kind of drugs in your life. I haven't seen any research that melatonin affects anything. I did see, I think, whoever helped research the article with us, there was one physician who hypothesized that because all drugs are taken care of by the liver, it could rev up your liver and eat through your birth control faster. And certainly if you see that you take melatonin and the birth control pill, and then you start to get breakthrough bleeding, yes, it has revved up your liver and it is now eating up all drugs faster. And I actually personally experienced that with pseudoephedrine. So when I take Sudafed to breathe for my allergies or for mainly for cold, like if I got some nasty virus, runny cold, and I'm like, I need to breathe, I need to sleep. If I take the Sudafed, then it will rev up my liver and it'll chew through my birth control. And so I'm like, do I bleed or do I breathe? And so that's a hard decision because I really hate blood, but I really want to breathe. And so I try to minimize the Sudafed because the Sudafed absolutely revs up my liver and chews through. And same thing if you're on any other medications plus birth control, there is always the theoretical risk that it will rev up your liver and eat through your birth control. So if you take a new medication or your medication goes up, or if it's an over-the-counter medication and you notice any breakthrough bleeding, that is a sign that your birth control may not be working. So you need to use a backup method or maybe some emergency contraception.
That's really interesting. Is that also the same reason that alcohol has that same effect on birth control? Like I've heard that if you are drinking alcohol and then you take birth control, it's less effective. Is it for the same reason with your liver?
Yeah, so I would say that if you drink alcohol just like that day or something and you take birth control, it's totally fine. But if you're drinking every single day or a ton or binge drinking, then certainly it could rev up your liver and mess it up. So one drink isn't going to do it, but a total binge might do it. And if you're a total alcoholic, then yes, those are definitely the mechanism. Your liver is an amazing organ, and its job is to detox everything, be it alcohol, over-the-counter drug, birth control pill, whatever.
Interesting. That's so good to know. Great. So, okay, number 2. Does birth control, make your boobs grow?
So, it depends how big your boobs are, but it does trick your body into thinking you're pregnant. And so what I like to say is there's pregnancy boobs. For those of us who've been pregnant, my boobs never hurt. And the way I knew I was pregnant is all of a sudden in the middle of the night, bam, my boobs hurt. And I had been trying to get pregnant. And so then it was 3 a.m. 3 a.m. seems to be magical. And all of a sudden my boobs hurt. And I was like, pee on a stick, pee on a stick, pee on a stick. So I went and peed on the stick and positive pregnancy test. So one of the first signs of pregnancy, if you're not the nauseous type, which I'm generally the nauseous type, but for pregnancy, thank God I was not, is breasts. And so you get these like bomb boobs, but like they're painful and you don't want anybody to touch them. And your husband's like, ah, and you're like, do not touch. They hurt. They hurt. They hurt a lot. And so some women may notice an increase in 1 cup size or a half a cup size. And it's because your body is being told it's pregnant. And so the boobs are growing a little bit.
Interesting. Yeah, so someone just mentioned we have a great video we were talking about before about alcohol and birth control. And if you guys want to stay tuned on all of that stuff, Dr. Yen has actually made a ton of incredible YouTube videos about all of these different questions, so many more complex questions that we can get into today, but they're all on our YouTube at pandiahealth.com/blog and also youtube.com/pandiahealth if you guys want to check those out. They have some really great answers to some great birth control questions. But yeah, so that's that on growing boobs. And I have a follow-up question to that. Is that a permanent growth or is it temporary?
It's a temporary because it's while you're on the hormones. So if you come off the hormones, then you will lose what you have gained. Just like in pregnancy, right? Your boobs go big, but they're not big forever. They go down. And so it is just temporary with the hormones. Some people say it might just be water, but I think it's part of the body pretending it's pregnant.
Yeah. Interesting. It's so crazy how our body can respond so quickly to changes in hormones and what we put into it. That's wild. Yeah. Great. So, okay, number 3. Does birth control make you sad?
So the research has shown in some like broad studies that women who are on birth control are more likely to have a diagnosis of depression, more likely to be on antidepressants. But what you don't know about that is women who are on birth control are in relationships. And as I like to say, who's most likely to crush your heart and make you want to die? Your significant other. It goes both ways. Like, oh, we are so lovey-dovey, happy. Hey, he looked at some other girl. He's watching that porn thing. That's not cool. Just like a lot of trauma that comes from being in a relationship versus not being in a relationship. And then also the diagnosis of depression and the medication. To get birth control, you have to have access to a doctor. And so then you're more likely to get a diagnosis, you're more likely to get medications, whereas somebody who's not on birth control can't afford to see the doctor, can't get a diagnosis of depression, can't get the medications, because about 10% of society is depressed. And I personally believe that antidepressants should just be in the water, because antidepressants don't make you crazy or anything. Just if you have a tendency towards schizophrenia, it'll bring it out. But it's not like it gave you schizo. You were going to be schizophrenic later, and it just brought it out earlier. But for all the sad people, it would bring them up. And it doesn't take you up crazy, happy, high. It's just, to me, a safety net. So for some people who are sad, let's say most people hang at a hormone level of 5, but some of us are born at 3. And so if my boyfriend dumps me, I will hit 0 faster than the person who's at 5. And if you gave me some antidepressant, then I'd be up at 5 with you. So when my boyfriend dumps me, I will only be at 3. I will not hit 0 and want to kill myself. And so that is my thing with depression. But certainly there are hormones in the birth control pill. And we have seen postpartum depression. But I think that's just because the whole pregnancy thing and breastfeeding and sleep deprivation is horrific. But the estrogen, the progesterone, each person with the uterus responds differently. And if there's 8 different progesterones, and if they put you on one and it makes you sad, then yeah, it will make you sad. Or like people who get pregnant, some women are barfy. If it makes you barfy, it makes you barfy, but it doesn't make me barfy. And then with the estrogen, the same thing. So by any time you add something, you certainly can bring out something. But I also think that relationships bring out sadness and anger and all the range of emotion. And then some people say, well, you know, it's going to make me sad or blah, 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 but try it. There's 40 different pills out there. And, you know, we can pick the one that we feel from the research, from your ethnicity, from your genes when we get that data in the future, if you want to give it to us, that we feel will give you the least amount of side effects. At Pandia Health, we're the only women-founded, women-led, the only doctor-led, the only academic doctor-led. And so I like to look at data and be like, when women use this pill, they all get breakthrough bleeding. And particularly I've noticed with Asians, Hispanics, and Latinas. So let's put everybody on this one where there is no breakthrough bleeding and the side effect profile is the same. And I want everybody to do well. So I will pick the one that has the least amount of side effects possible. And then if you don't do well on that one, it makes you sad, gives you the munchies or something like that, there are 7 other ones that we could try.
Yeah, and that's what we were talking about last week too, is that it's not just one symptom for everybody, all women, the same reaction to the same birth control, right? There's only one place like Pandia Health that can actually go through every single type of birth control with you and find the right one for you. So yeah, I think that's also great to know, is that it's not just a blanket statement like, oh, this always happens when you're on birth control. You really have to find the best one for you. And you can do that with doctors like yourself at Pandia Health. I have one question in the comments. Let's see. With breakthrough bleeding, I heard you say to take 5-day break. Am I supposed to take the placebo pills that you're on? So yeah, let's talk about sugar pills for a second. Are those necessary? Are they placebo? Like what do those mean?
Yeah, so you'll notice on a lot of the pills, there's 3 weeks of one flavor, and then the last week is either white or sometimes they're brown. If they're brown, they just added iron in them because during those days you will bleed. And so they want to give you back the iron that you're going to lose. But that week is purely optional. So what if you're trying to skip your period, which I believe, you know, is a good thing and actually decreases your risk of endometrial, ovarian cancer, and colorectal cancer and decreases your chance of anemia, then you take the 3 week of active pills, skip that last week, no matter what color it is, and go straight into the next pack. Okay, never be not taking a pill. But as Jewel has brought up, if you've taken 3 weeks of active pills and you're like on week 6 or 8 or 12 or 20 or 36, and all of a sudden you get some breakthrough bleeding, we used to be like, just suck it up and barrel through. But now we know that if you come off for 5 days, you could take those placebo pills if it makes you happy and you like to take a pill to remember. That might be a good idea. Or you could just come off for 5 days. During that 5 days, whenever you drop that hormone level, you will get bleeding and you will have a clean out. And so you will clean out for 5 days. On day 6, whether or not you're still bleeding, start the new pack. So to answer Jewel's questions, if you're trying to skip your periods, don't take that last week. Otherwise, you will get a bleed. It's an artificial bleed. It's not a normal period. It's a withdrawal bleed. And then if you're trying to skip your periods, just keep going on the 3 weeks of active pills. And then if you get breakthrough bleeding after 3 weeks of active pills, if you're using it for birth control, because if you only do 1 week or 2 weeks, then you risk pregnancy. Then you can take the placebo pills for 5 days, or you could just come off for 5 days and then have a bleed. And then on day 6, whether or not you're bleeding, restart active pills.
Interesting. So it's kind of like a clean out. It's not really a normal period, is what you're saying. It's good to know too.
Cleaning everything out, bleeding it down to the base, and then beginning again.
Yeah. Okay. So our next FAQ about periods. Does birth control make you tired? I know I wondered this a lot when I was starting birth control too, is like, I'm a high school student, I'm a college student, how is this going to affect my productivity? How can I do everything normally? So yeah, what's your take on that? Does birth control make you tired?
I would say actually the opposite. So the number one cause of anemia in a menstruating woman is menstruation. So the number one cause of anemia, low hemoglobin, low red blood cells, and therefore low oxygen in your blood, is losing blood 1 week out of 4. And when you're on the pill, or the patch or the ring, or the IUD or the implant or any hormonal method, rather than building that lining, ton of blood every month, waiting for an embryo and like, no embryo, and bleeding it out, it's just a little bit. It's not this much, it's just a little bit. And so when you decide to bleed, it's just a little bit. And so the example I give is if you used to bleed 7 days on your period, when you go on the pill, it'll go to 5, it'll go to 3. And so it's less blood. And so if you have a lot of blood loss, you lose the blood, you have less oxygen, then you feel tired, you feel cold. And so if you feel tired and cold, those are signs of anemia. That's not your pill. And the pill will actually stop you from bleeding less blood, and you will gain back energy from that extra blood, extra oxygen running around. And as I like to say, as you mentioned, performance. They've shown in research that that women generally do better not on their period for their sport, right? You can imagine if you're trying to run and your body's trying to bleed, it's counter good. If you're trying to swim and you're trying to get a cramp, that's not so good. And specifically for me, this is the story I tell over and over. In the middle of a biochem final as a pre-med, blood, a little distracted, and the dude next to me is like, and I have 2 daughters, and I want my daughters to go out and crush the men, or at least show that women are equal. And it's hard if you're bleeding in the middle of a test.
Yeah, I've definitely been in all of those positions before I got on birth control. I play softball in college, so I've been playing sports for a really long time, and it's so inconvenient when you're wearing white pants and that's just part of your uniform, and then it just happens and you're like, what do I do now? And you can't perform your best. So yeah, that's a really great point. It's not just that it doesn't make you tired, but it actually helps you in your performance because you don't have to deal with all of this stuff while you're trying to do your best at something.
Yeah, and even if you have a tampon in, it's still, if it like not in the right place or whatever, but just the blood loss. Like the person with more blood, and they've actually seen in elite runners, they go up to low oxygen places, so they will build more blood cells, so that their body actually builds more blood cells. And so when you're losing blood, you are less blood cells than the person next to you. So you will be able to hold your breath less underwater. You will be able to run less. And it may be just seconds, but when you're at that elite level. And so I thought it was really funny with the US soccer team. I really want to make friends with them because they were all excited that they use this app and they synchronize their sleep and their nutrition to maximize. I was like, is your team doctor a woman or a man? Because if it was a woman, I would have turned it off. Right? Like, not even an issue. Why are you all like sinking and bleeding and, like maximizing, like, just turn it off. I'm pretty sure you will kick your own butt if you looked at your own, scores of running and field goals and blah, blah, blah on your period or off your period.
Yeah, no, that's a great point. It's just, it helps performance all the way around. And so the next question I kind of had was, with regards to stopping birth control and how that affects your body going forward. So does it affect fertility? Can I stop at any age? And these are just some questions that I've at least had. Like my mom had concerns about this when I was going on birth control. And I myself have watched a lot of your YouTube videos. Again, youtube.com/Pandia Health for some great answers to these questions. But yeah, could you just maybe go over that a little bit and talk about how birth control affects your body after you stop it?
Yeah. So the news is that the pill is pretty much pill, patch, ring is out of your body within 3 to 5 days. I mean, it's technically out of your body immediately, but you have to give it a couple half-lives, to wash out. And that's why you have to take it every single day. And that's why if you miss 2 or 3 days, you go from this level down to this level, you bleed. So when you bleed, it's out of your body. right?
Huh.
And so that's a sign that the medicine is gone. So know that the medicine is out of your body immediately when you stop it. You take off the patch, you take out the ring, it is out of your body. Certainly with the shot, there is some lingering thing, and we've discussed that before. It can take up to 8 months for that to wash out of your body. But for me, if you're a young teenager, you have 8 months to spare, right? But if you're like a 35-year-old who needs to get pregnant now, then yeah, Depo-Provera might not be the good one, because when you come off, it'll take an extra 8 months, you know. The other thing is with respect to infertility. This question comes up a lot. Does the pill, the patch, the ring, IUD, implant, any of these hormonal methods, or even the copper IUD, make you infertile? And my favorite thing is, of course, it makes you infertile while you're on it, because that's why you're taking it. But the question is whether it has long-term effects after you stop the medication. And the answer is no. All the hormonal methods have no long-term effects on your body after you've stopped it, except for, you know, Depo-Provera, which we've mentioned before, can have effects on your bone density and can take 8 months to get out. But like the pill, the patch, the ring, as soon as you stop it, it is out of your body in 5 days. Infertility, the tricky part is you have to learn about PCOS. So PCOS is polycystic ovarian syndrome. It will affect 1 in 10 women. So if we are giving a talk to 30 women right now, 3 women in the room have PCOS, and PCOS, or will get it in their lifetime. PCOS is hairy, acne, so it's hyperandrogenism is one of the criteria, and then irregular periods is the other. So if your periods happen every 2 or 3 months, or you only get them a couple times a year, or you haven't had one for 6 months, that is irregular period. And then the second part is hyperandrogenism. So high male hormone, high testosterone. One, we could just do a blood test and check for the free testosterone. Is that higher than normal for a female? And then, but the more manifestations that you would see is hairy upper lip, hairy chin, hairy back, hairy chest, or acne all over the place. And that's also part of teenager life, right? That you get some hairiness and you get some acne. And so it's hard to tell. But the really weird part is the irregular periods. And the reason why it's irregular is every month you have 3 to 5 little eggs fighting to see who gets to win and get out and be the winner and be the future baby. And so the one that wins is the one that gets the most estrogen. But if you throw some testosterone, male hormone, that messes things up. And so then it doesn't pop out. And if it doesn't pop out, then you can't get pregnant. And that makes it difficult for you to get pregnant. So the PCOS women will have difficulty getting pregnant, because if you don't pop out eggs, you cannot get pregnant. And so again, if we put all women on birth control, pill, patch, or ring, 10% of them have PCOS. 10% of those women will have a hard time getting pregnant. And then we take all women off the birth control pill, 10% of women will have a hard time getting pregnant. Is it because the pill, the patch, the ring? No, it's because they had PCOS or they developed PCOS while they were on the pill, patch, ring. And it's not because the pill, patch, ring gave them PCOS. It's just if we all gain weight, we will get PCOS. And so there's the freshman 15, there's the COVID-19, there's just life in the United States and maybe not in other countries. I think Asia is better at avoiding all these extra weight. But if you gain any extra weight after high school, then you are at risk of PCOS.
That's interesting. So it's not necessarily, it's never the birth control that's making you infertile. It's just something else like PCOS that you might have gotten along the way, but it's not to blame because the hormones actually leave your body pretty quickly is what I'm hearing.
Yes. And then the other caveat on that is I gave a talk to a bunch of infertility specialists in Taiwan. I was like, why am I here talking about birth control with infertility specialists? But the infertility specialists, use birth control to normalize the PCOS patients, because the PCOS patients, their hormones are so whack. And then when you put them on the birth control, it shuts everything down and puts them at normal. And we tell the PCOS patients that it's going to be hard for you to get pregnant. So it may take a while, blah, blah, blah. But that's not true. As soon as you come off the birth control, that's when you want to get pregnant as a PCOS, because that's as normal as you're ever going to get. And you will only get weirder the longer you are off birth control for the PCOS patient. And for other patients, they'll like use the birth control just to stabilize things, and then they'll kickstart you and go at that. So,
yeah, so birth control is not only useful in regulating your periods and kind of, it just gives you control. It's called birth control, but it gives you control as the woman of your own body. It helps you control your acne, and it helps you control your periods, and it helps you not get pregnant. So I think, yeah, definitely everybody who's watching, check out Pandia Health, because periods are optional. That's what we want to advertise here, is periods are always optional. You could choose when you want it, and you can be in control of your own body. And that's the most important thing and the most amazing thing about this, I think. So yeah, I think that was all of our questions for today, unless anybody in the comments has some other quick birth control FAQs. Yes, control. Control is key.
Your body, your choice.
Yeah, take power over, control over your own body. I think that's incredible.
And just, share with everybody, we're the only women-founded, women-led, the only doctor-led company in this space, and we give you your choices. And if your company is not giving you at least the pill, the patch, the ring as a choice, they're not practicing standard of medicine. They're not giving you informed consent. And if they're trying to push one thing over another, you got to be suspicious. We don't do that.
And no one knows better about a woman's body than a female doctor. So who else would you want to take to help you decide what birth control to take other than someone like Dr. Yen? So come to Pandia Health. It's incredible. Everybody wins.
Yes. I've personally taken a lot of birth control.
She knows all the answers. Awesome.
I've tried them. I've tried a lot of them.
She's tried all 40 options, so you don't have to. And she can tell you exactly which one might be the best for your body.
I have tried many of them, maybe 20 of them.
Oh my gosh. It's crazy. Awesome. Well, thank you so much for being here today, everybody. Sorry again for the technical difficulties at the beginning. But yeah, thanks for joining us. Again, we're here every Tuesday for our Trendy Tuesdays about birth control with Dr. Yen. And make sure to check out Pandia Health's birth control delivery services at pandiahealth.com and follow us on all of our social media. And again, we left some great tips in this live, but if you want to learn more about all of these different birth control questions, you can check out youtube.com/pandiahealth. Dr. Yen has put so much time into creating these videos for you about all of these different birth control questions, and also our blogs at pandiahealth.com/blogs. So thank you so much, everybody, for watching. And thank you, Dr. Yen, for being here. It was great to have you.
Thank you for having me. Always happy to answer anything about birth control and your V.
Oh, yeah. Thanks, everybody. Have a good day.